Hello, my name is Dr. Yolanda Pickett. I consult for a large home care agency in the Bronx. I'm a geriatric psychiatrist. Today I'd like to talk to you about the use of non-selective serotonin reuptake inhibitors, or non-SSRIs, for treatment of depression. So there are three important neurotransmitters that regulate the symptoms seen in depression, and they are norepinephrine, which is responsible for executive functioning, motivation, and social behavior; serotonin, which regulates mood, appetite, libido, and cognition; and dopamine, which is responsible for motivation, concentration, and pleasure. And as you can see in this graphic, the neurotransmitters work both individually and in combination with each other to regulate the body's normal functioning and normal psychological functioning. It is important to notice the overlap of the neurotransmitter function in order to understand how medications have been designed to target the various symptoms related to depression and other mental disorders, and also how these medications use a combination of the neurotransmitters in targeting these symptoms. So to help us understand better how these medications work, it's important to understand the functioning of the brain cells, or the neurons that they target. So here, in the first part of this, you see that the electrical signal is traveling down one neuron into the next. So this is the way that electrical signals are being transferred and information is being transferred about the body's functioning. So the neurotransmitters are stored in these vesicles, and once the electrical signal reaches the end of one neuron, it empties out these neurotransmitters into the synaptic area. And this allows for binding of the neurotransmitters at the receptor sites. And this allows for the continuation of the signal from one neuron to the new neuron. And once the signal is transmitted, any excess neurotransmitters that are left in the synaptic space are then reabsorbed back into the presynaptic nerves. So any combination of these mechanisms are the target of antidepressants. And the reason for that is if there is a reduction of a neurotransmitter, decreased levels in the brain, that the antidepressant can work to try to keep the levels of these neurotransmitters high in the synapse so that binding can occur on the postsynaptic neuron. So the next slides will show various categories of the non-SSRI antidepressants and the areas that they target in this process. So the first group are the Norepinephrine-Serotonin reuptake inhibitors, and as the name suggests, these antidepressants block the reuptake of both norepinephrine and serotonin in the presynaptic nerve. And these medications are Effexor, Cymbalta, and Pristiq. And some of the common side effects of these medications are loss of appetite, weight, and sleep. They can also cause drowsiness, dizziness, fatigue, and other symptoms that we need to be very mindful for in older adults especially. Some of the contraindications for use of these medications are hypertension. In Cymbalta, we would not use these medications as frequently in people that have hepatic failure or glaucoma. And another thing that I wanted to bring out that the slide doesn't show is that this category of medications are used to treat depression as well as anxiety disorders. So for our patients that have increased anxiety with depression, this might be a good first step, as well as the SSRIs because of the serotonin. So when patients discontinue or stop these medications abruptly, they may have what's called a discontinuation syndrome. It's like a withdrawal of the medication, and they could experience physical complaints because of this. So it's very important for patients to alert the doctor they want to stop these medications so that they can be tapered off gradually instead of abruptly stopping and experiencing this discontinuation syndrome. So the next category of medications are the Noradrenergic and specific serotonergic antidepressants, which is a mouthful. So these medications actually block the alpha-2 receptors, and this causes an increase of norepinephrine-serotonin in the synaptic space. They're used for the treatment of depression, but they're also used for insomnia, anorexia, and in some instances anxiety. And the main medication in this category is Remeron. So some of the common side effects that we see in this medication are sedation and increased appetite, as we said earlier, but sometimes physicians use this medication because it's helpful for people with depression who have insomnia and who have decreased appetite or weight loss. Other side effects that you should be aware of are dizziness, blurred vision, dried mouth, constipation, and joint and muscle pain. These medications can interact with fluoxetine, which is Prozac, and paroxetine, which is Paxil. These two other antidepressants can cause an increase in the level of Remeron. So if they're used in conjunction, the prescribing physician, or it's good to be aware if they're used together so that doses can be adjusted so that there's not increase in side effects due to the increased levels of Remeron. Also, carbamazepine, which is an anticonvulsant medication used for the treatment of seizures, can decrease the levels of Remeron. The next category are the Norepinephrine-Dopamine reuptake inhibitors, and as the name suggests, it inhibits the reuptake of dopamine and norepinephrine into the presynaptic nerve cell. This medication, basically Wellbutrin, is used for the treatment of depression, but also for narcolepsy and for nicotine dependency. It was marketed a few years ago. Bupropion was marketed as Zyban, which was used for smoking cessation. Some of the common side effects, again, are dry mouth, nausea, insomnia. But in Remeron, which is activating in some patients, you can see an increase in tremor, anxiety, blood pressure levels, excessive sweating. So it also causes people to have insomnia if they take it too late in the day. So patients need to be educated about these side effects. And this medication is contraindicated in people with seizure disorders because it lowers the seizure thresholds. So the last category of antidepressants that we're going to talk about today are the tricyclics. And this is an older class of antidepressants, not typically used as a first line of treatment now, but you may see patients that have been on them for many years or who are on them for other reasons. These medications block the serotonin and norepinephrine transporters. They're used for the treatment of depression and anxiety, but they're also used for eating disorders, enuresis, personality disorders, and more importantly for chronic pain. So you may see a lot of patients who've been prescribed these tricyclic antidepressants by other physicians such as neurologists or primary care physicians for the treatment of their chronic pain. So it's important to understand why the patient is taking these medications. They include Elavil, Tofranil, Pamelor, Norepinephrine, and Anafranil. Some of the most common side effects are dry mouth, dry nose, blurred vision, constipation. They can also cause urinary retention and cognitive impairment. And more importantly, these medications can cause cardiac side effects if they're used in overdose. So, and these side effects can be fatal, which is why a lot of patients aren't prescribed these anymore as a first-line medications. The newer antidepressants are generally safer in overdose. So patients need to understand that they have to take these medications as prescribed so they won't have any cardiac side effects, especially those that already have pre-existing cardiac conditions. Okay, this ends our talk today. I'd like to thank you for participating in this mini lecture. Thank you.